The treatment for multiple sclerosis is an ongoing process and starts from the first symptom and goes throughout the life of the patient with multiple sclerosis. And as such, it should be personalized and it should change actually over time depending on the patient's needs. The use of disease-modifying therapies or DMTs is one aspect of the treatment, but ideally should be as part of a multidisciplinary, comprehensive approach to the care of MS patients. But why do we use these therapies? These therapies work by working with your own body, with your immune system, to try to control the way the immune system interacts with your brain and causing pathology in multiple sclerosis. So these therapies in general will not impact directly on the symptoms that the patients may experience, but they will impact on the way the disease progresses over time. We currently have 13 approved medications for the treatment of multiple sclerosis, and of those medications, they vary in terms of side effect profile, efficacy, and other potential benefits that the medications may cause. How do we know that a medication is working? Basically, we'll look at how the patient is doing, the physical exam, the progression, the symptoms, but also we'll look at the MRI as a way to understand how much pathology is being accumulated over time in a given patient. We also look at overall progression of disability. The goal for these therapies is to accomplish what is called no evidence of disease activity, or NEDA, and that means no new relapses, no progression, no more lesions. We do that by looking at the patient's physical exam, by looking at the MRIs, and by getting also a sense of the quality of life that the patient is experiencing. For that, we are incorporating what is called patient-reported outcomes into our clinic, and those are questionnaires that the patients can fill and give us an idea of how they are doing with their disease. So take-home messages. It is important to have a team to talk to your healthcare provider on the need to use medications. It is important to also discuss not only efficacy, meaning the benefits, but also the risks. All of these medications have some safety concerns that are particular to every medication, and not every patient responds the same way to these medications. So ideally, the treatment should be individualized to a particular patient and their needs at that point. It is also important that you are prepared when you talk to your healthcare provider to be able to discuss your questions, your concerns, and also any other healthcare related questions that you may have, including a careful history on other disorders as well as medications you are taking.